Right, it's live.
Are we live? Right.
Yep, you're live. Smile.
All right. Okay.
Okay.
Okay. Hi, everyone. It's actually been a while since we hopped on here to do a live session. So today we are here with our consultant urologist, Dr. Muhilan Parameswaran. Hi, Dr. Muhilan. How are you doing? Especially in this lockdown and everything. How are you managing?
Hey, not bad. It turns out my life is boring, so the lockdown didn't make a difference. Okay, it's still boring.
So
But yeah,
we pass the time.
um, well, like I said, it turns out I'm a very boring person. I usually chill out at home, have a drink, read a book. So lockdown made zero difference to me. I'm pretty
Yeah.
much work home kind of a person.
Yeah. Speaking of lockdown, we're actually pleased to share that Thomson Hospital Kota Damansara has recently launched a new and more advanced appointment and queue system in our hospital. So now you can actually have a faster, more efficient experience using this app. So all you have to do is to go to our app store and then just search for Thomson Hospital Kota Damansara, download the app, and you can actually track your queue number now in your mobile phone. And this means actually less waiting time in our hospital. So especially in this period of the COVID and the pandemic and also the lockdown, this is certainly a useful and a more value added way for our patients. So yeah, I hope everyone would download that. And if you're coming here for an appointment, that would be a great way to check on your queue number. All right, so today we're actually going to be talking about blood in urine, right?
Right.
So seeing blood in urine can be alarming, right? While in many instances this cause is harmless, but blood in urine, or I think the medical term is known as hematuria, can also indicate like serious disorder. So if you know anyone or yourself who have been experiencing this, or you notice there's some blood in your urine, then this is a great opportunity for you to ask
Right.
Dr. Muhilan.
All right. So the net's a bit slow today. Okay, we're going to blame the Malaysian government for that. Okay. Right. So, if you have blood in the urine, there are actually two types, right? So there's one where you actually see fresh blood. That means you go pee and you get this horrible surprise where you see fresh blood in the urine. So that's the scary one, right? Second one is where you go for routine checkup for whatever reason, and your doctor checks your urine and you have what's called microscopic hematuria. There is blood, but you can't see it, right? Now, it changes a little bit with age and with gender, whether you're male or female. So if you have, let's say the big one, fresh blood, you wake up in the morning, you pee and you see fresh blood. So it's scary. If it's painful, that means when you pee and you have this agonizing pain, that's actually a good thing, right? So that means it's a stone, easy to fix. Come to a hospital, we get a scan done, we fix it. Not a big deal. Honestly, not a big deal. So pain is a good thing. If you have burning urine, if you have discomfort while peeing, again, it's a good thing. It means infection. So the key here is if you pee blood and it's painful, chances are it's just an infection or stone. So a good thing, right? So pain is a good thing here. Let's say you pee blood, you feel absolutely nothing. That means you're perfectly fine. You don't feel pain. You don't have any discomfort. That's the bad one, right? So in about one in five people, sadly, that means there is a cancer sitting somewhere in your body, right? And commonly, that's a cancer of the kidney, or cancer of the bladder, or cancer of the prostate. In women, the additional headache, because women are complicated. If you are complicated, women are complicated. After 50 years, I still don't understand women.
I hope.
Okay. What happens is if you have cervical cancer, which is actually the commonest cancer in women, there are a huge number of women who come with blood in the urine. If you have a colon cancer, it can come with blood in the urine. But in women, it's a big one. Cancer cervix can present with blood in the urine. Thankfully, the numbers have got less. Women are going for their checkups, they're doing their pap smears. So we don't see it that much anymore. So the key thing is, it can be an infection, it can be a stone, or it can be a cancer. And in about 15% of people, we do a thorough check for you and we cannot find anything. So this is fairly normal. It means you may have a mild infection or mild stone that came out. So it's settled. That's it. You're done.
Okay.
Okay. Was that clear?
Yes, great start. Yeah, just
Okay.
our followers who have joined us, we are currently talking about blood in urine or
Right.
any uro-related matters. So if you have a question for Dr. Muhilan, you can leave the questions at the comment section below. Or if you want to remain anonymous, that's completely fine. You can leave your question in our DMs and then we will address it. All right, so Dr. Muhilan, perhaps we can also go into what are the main signs to look out for or the symptoms, specific symptoms if you have blood in your urine, because sometimes even taking certain medications can cause urine to turn red. So how can you, identify or differentiate?
All right. So the main medication that turns your urine red is the medication we use for tuberculosis, right? So that one is known to cause your urine red. In Malaysia, because Malaysians are weird, for some reason, dragon fruits turn your urine red, and I can't understand why. Okay, because logically it's not supposed to do it, but anyway, certain fruits like dragon fruits, high usage of carrots, beetroots, they discolor the urine and it looks reddish, right? But it's a kind of orange reddish kind of color, and there is no pain. So the simplest thing is, if you think you have a funny looking urine, all you have to do is do a urine analysis and they will look for red cells, red blood cells. So the red blood cells are there, it is actual blood in the urine and not because you ate too much dragon fruit the day before. You have to eat a serious amount of dragon fruit for that to happen, by the way. Okay.
All right.
So, but that's about it.
Shaded, right? So the moment you see a discoloration or like red color in your urine, so it's best to seek medical
Yeah.
yeah.
Yeah, you don't have to freak out too much. Just, the moment you have blood in the urine, go see your GP, see your doctor, or come to the hospital, come to Thomson. We have what do you call it? We have a 24-hour service. All you have to do is just pee, give us the bottle, we will check it. And we can tell you if you have an infection, we can tell you whether there's evidence of stones, we can tell you whether there's evidence of cancer, and you get the results within, I don't know, 30, 40 minutes. We are pretty efficient. So we get it out pretty fast, right? And that would be your first step. Okay. Once you have it there, we'll go through it step by step with you and we'll take it through. All right.
Okay, Dr. Muhilan, we actually have a question here from our DMs.
Right.
Okay, so it says, hi, doctor. I'm diagnosed with overactive bladder.
Ouch.
I have been on Betniga. Is that
right?
Betniga?
Yeah, Betniga, yeah.
50 mg for a year now. So
right.
I think her question is, when should I stop taking the medicine, or is this a lifelong affair? Is this something
right.
for life?
Okay, so if your doctor says you have overactive bladder, then what it means is your bladder acts up, you run to the bathroom very often, you're going up at night. And it also means we have found no other reason. That means there's no infection, there's no cancer, there's no stone, there's nothing. We have checked you, there's nothing. So because we don't know why it happens, there's no cure. We can control it. And usually what I do, I give it for about a year, year and a half, and then I start reducing the dose. So I'll reduce it to once in 2 days, once in 3 days, and we try to see how good you are. So if after 1 year, your symptoms have sort of settled down, we start reducing the dose. And in about half the patients or half the guys who take it, we find that we can totally take it off. But we start doing it about the 12 to 18-month period. So if you have been taking about 1 year and you're doing really well, you can try slowing down the dose. Take it once in 2 days. If you're good, take it once in 3 days, and then so on and so forth. Right? So you don't have to take it for life.
Okay, so eventually you can reduce the dose, and that might relieve the symptoms, right?
You don't come back. The symptoms won't come back. Yeah.
Okay. All right. Great. So coming back to blood in urine.
Right.
What are some of the causes?
Right. Okay. So the big ones, like I mentioned earlier, the stones, the cancers, and the urine infections, right? So of the three in Malaysia, the commonest one is urine infection, especially for women below 50. The commonest reason is urine infection. So you have a bad infection of the bladder. All right. So you'll have some pain just above your pubic bone. When you pee, it's like passing glass, right? It's like burning fire passing out through your urethra. And classically, you see it in sexually active women. For guys, stones and cancer are more common, right? So the diagnosis, the first step is still the same. Do a urine sample. If it looks like infection, we treat the infection first. Recheck the urine. Blood is clear, good, continue with life. If after antibiotics, you still have infection, you still have blood in the urine, you get a scan, and the scan will show you whether you have a cancer or whether you have stones. And then we treat it, right?
Okay. Great. So these are the main three causes that.
Yeah, those are the three big ones.
Okay.
I don't know, it's a bit difficult.
Okay. All right. Again, for those who have joined us, thank you so much for joining us today. We're actually talking about blood in urine and uro-related questions. If you have it, please leave it down in the question in the comment section below, and Dr. Muhilan will address it.
So, quick question: have you ever checked your urine?
Me?
Yeah. Have you checked your urine?
No, I have not. What do you mean, like in terms of the color?
No, nothing. Have you ever done a urine test to see whether you got blood in the urine?
No, I have not.
Aha.
I guess there wasn't a time for there wasn't a cause for concern for me to go and check. So yeah, I never did.
Okay, so by the way, this one is for the gynaes. Have you had your pap smear?
Me?
Yeah.
Yes, I have.
Okay, good. So routine checkups for everyone above say 30. For women, is a pap smear, but a simple urine check and a simple ultrasound once a year is a wonderful thing.
Okay.
Okay, because seriously, most of these problems, by the time we see it, it's like 10 years later or 5 years later. So it has been growing or developing in your body for about 5 to 10 years before we actually can see the symptoms. So if you've been doing your urine check off and on or getting your pap smear, we usually tend to pick it up a bit earlier.
Okay. Yeah, I think that's great advice because like what you mentioned earlier, there's two kinds of hematuria.
The microscopic and the
one as well, right? So I
right.
might I just don't know it. So I think it's like what you say, it's really good to have a medical checkup done every 1 year or so.
Yeah. So shall I arrange your appointment? You can see me tomorrow.
We'll see about that.
Chicken. Okay, right.
Anyways, all right, moving on to the next question, right?
Right.
Kalau kurang minum air boleh menyebabkan kencing berdarah.
Okay, by itself tak mungkin, alright. If you kurang minum air and you dapat kencing kotor, boleh kencing berdarah. If you kurang minum air and batu terjatuh, batu memang dah ada. That means the batu memang ada dalam buah pinggang. Yes. Why? Who told you that kurang minum air?
I don't know. We just have a random question here.
Okay. So by itself, no.
Explain a little bit more about what is kencing kotor.
Okay, so kencing kotor. All right, so it's the commonest thing that everyone says for urine infection. So the reason you say kencing kotor is when you pee, it either has a bad smell.
Oh no, what happened? He just froze.
It looks cloudy. If you I had an incoming call, sorry about that. It turns out my phone freezes. Can you see me?
Yeah, I can see you now. You froze a bit for a while, but now I can see you.
No, I had an incoming phone call, and it turns out my phone freezes whenever there's an incoming call. I have no idea why. Okay. Don't buy my phone. Buy another phone. I can't tell you the brand, I get sued. Okay.
Okay.
All right. So kencing kotor is what almost everyone describes urine tract infections, right? So where you have painful urine, pain in the abdomen, cloudy urine, and dirty smelling urine. So why do you get it? Commonest reason is if you are someone who has sex, if you have an underlying stone, or if you sometimes very rarely with cancer. And by the way, when I say you have sex, I'm not talking about STDs. These are normal urine infections. Female vagina has good and bad bacteria in it. And if the bacteria in the wrong place, you get a urine infection. And if you give it to your husband, it's not an STD. Don't blame him. Okay? Straight away.
All right.
All right.
Yeah, speaking of like the amount of water you take on a daily basis, right?
All right. So ballpark, right? So let's say you weigh about 70 kilos. Let's say average size person. Sadly, I weigh a lot more than 70 kilos, right? But say, take it about 40 meals per kilo. All right. Hey, come on, I lost some weight, okay? Not that bad.
Actually.
Okay, so anyway, 40 kilos per kilo per day. So if you weigh 70 kilos, that's about 2.1 liters in a day. But that includes everything. That means your coffee, your tea, your soup. And the good thing about Malaysian diet, we actually have a lot of water in the rice and vegetables. And the noodles, it contains a lot of water. So don't measure how much you drink. Look at your urine. If your urine is a light yellow color, you're drinking enough. Because let's say you follow my advice, you drink 2.1 liters and you decide to go and climb Bukit Gasing. Okay. I support Bukit Gasing. So climb Bukit Gasing, you will sweat. If you drink normal amounts of water and you do heavy activity, your urine will be dark, which means your body is telling you, you do not have enough urine, enough water, right? So look at your urine color. If it's a light yellow color, you're drinking enough. If it's dark, it smells bad, drink some more. And you can drink anything. You can drink fruit juices, vegetable juice, anything, plain water, whatever you like, just liquids.
Okay. Is there such a thing as too much of water? How do you know?
Yeah.
There is?
Oh, yeah, right. So I had this very small size woman. She weighed about 40 kilos. Okay. Couldn't believe she's Malaysian. She's 40 kilos, right? Very small size. She drinks 5 liters of water a day. Now, if you drink 5 liters of 5 liters of water a day and you weigh 40 kilos, two things. You will literally spend your life in a bathroom. You come out, your bladder will fill up, you go back in. Because your body only needs a certain amount. Anything above the amount, it will throw out. So you will pee really, really often. Number one. Number two is, if you drink only plain water, that means there's no salt, it's just plain water, or if you drink a lot of reverse osmosis water or something like that, you will dilute the salts in your body. And the salts in your body are the ones that carry signals from one part of your body to the other. So there are patients who have blacked out because the salt level is too low. They look confused. They look like they had a stroke. They look drowsy. So yeah, there is actually a medical condition by people who drink too much water. But most people will stop doing it because going to pee every 20 minutes is no fun.
Yeah.
I mean, can you imagine? You can't sit through a meeting, run to the bathroom. A good excuse to escape from your boss, by the way.
Okay. All right. So it really depends on your body weight as well, right?
Your body weight and your activity. So let's say let's say me and Hilmi, you know Hilmi, right? So we're about the same size. So I drink 2 liters and I sit in the office. Hilmi is active. He drinks 2 liters and he jogs 10 kilometers a day. Obviously, Hilmi needs more water than I do. All right. So it's so logical, but we are not going to measure how much we drink. So just look at the urine. Hilmi jogs for 10 kilometers, which he's sitting next to me and he has promised to start tomorrow. Okay.
I'm keeping that.
Yes, please do. You can chase him with a cattle prod to make sure he jogs 10 kilometers. By end of 10 kilometers, his urine is going to be dark. He needs more water. Simple. It's really easy. Look at the color of your urine, right? And if you feel thirsty, drink.
All right.
That's it. It's not rocket science, right? It's pretty easy.
Yeah, okay, yeah, that's good advice. Yeah, speaking of running, right? I've actually read that if you're a marathon runner, you're actually more prone to hematuria.
Right. So it's not just marathon runners, it's like pro level athletes, right?
Okay.
So if you're a pro level athlete, you actually break down and rebuild muscle on almost a continuous basis. Okay, we don't actually know why, but we've seen it in pro level athletes. That means like heavy duty, guys who cycle 100 kilometers, heavy marathon, the Ironman athletes, they have traces of blood in the urine and it's blood leaking from the kidney. That means there's no cancer, there's no stone, but literally your kidney leaks blood. We don't understand what it means. Does it? What I mean is we don't know whether it's a bad thing. Is it going to damage your kidney? We don't know. We know it's there, but we are not really clear on why it happens or what it means in the long term. But if you are a pro-level athlete and you come with blood in the urine, I will still do a checkup, a full checkup for you for stones and cancers. If you don't have it, good, but we'll monitor your kidney function.
Okay,
but this is not Hilmi with 10 kilometers, this is Hilmi after 100 kilometers.
Consistently.
Yeah, consistently. Hilmi, start 10 kilometers tomorrow. Okay.
All right. Okay.
All right.
To the next question. And the next question is, if I have a family history of blood in urine, right?
Right.
My mother is commonly have this.
Right.
Am I prone to it as well?
Okay. So sadly, women after the age of 50, about 5 years after menopause, the urethra, the part that you pee, actually tightens up. It's called atrophic urethritis. So what that means is the whole vaginal area becomes tighter. And in the old days, we couldn't fix it. Now we can. We have medication for it. You don't pee well. So you strain to pee. You pee often. So there's no cancer or anything, but that condition causes you to have traces of blood in the urine. But this is common in post-menopausal women after the age of 50, right? Usually, people will tell you, right, look, I go to the bathroom, I have to hang around for a little while before the urine flows. I finish passing urine, it's not complete. And then when you check the urine, you'll find microscopic hematuria. Very common in women. It's not a familial condition. I mean, it's not because it's in your family. It happens to almost the majority of women 5-6 years after menopause, right? But by the way, good news, we can fix it, right? There's a lot of stuff now to make it better.
Okay, so it's more prone to women, right? Blood in urine. What about
men, right? Okay, so a question of women, right? So guys, about the age of 40, your prostate, which grows throughout life, becomes significant, becomes noticeable. And enlarged prostate by itself, without cancer, without any problems, can cause traces of blood in the urine. All right, so God made us equal. Okay, He gave you all menopause and gave us an enlarged prostate, just to be fair. Okay. So both of those conditions can cause traces of blood. Again, it is nothing to do with your family. It's got everything to do with you being male, female, and getting older. All right. Did I answer the question?
Yep.
All right, cool.
Other questions is pretty much what you have already covered.
Right.
The next one is, does blood in urine indicate a bigger medical problem or condition? And I think we've covered this earlier, where it might be cancer, it might be UTI, it might be
a stone.
Right? The streaming. Oh, right. Okay, so maybe we can talk a little bit about diagnosis.
All right. So, okay, so I'm someone who believes in step by step. Each doctor has a different way of doing things, right? So mine is I tend to do it very slowly, step by step, and I go from the simplest to the most expensive one, right? So the simplest thing you can do, which anyone can do, is take a urine sample, do a proper urine microscopy. It's cheap. It costs you like 30, 40 bucks. You can do it any lab, all right? But of course, I have to say this, if not the CEO will kill me, Thomson's the best. Okay, right? But anyway, jokes aside, we are good at this. So all you have to do is you put it under a microscope and you get a pretty detailed idea of what's the problem. You can see infection, you can see kidney damage, you can see cancer cells. So that's a simple test, right? All you do is pass urine, but please remember this. Bring your morning sample of urine from the home. Because what happens when you come to the hospital and I tell you I want a urine sample, you step out of my room, you drink 5 liters of water, and you give me a sample of urine that looks like water. I can't tell anything.
Okay.
So you want your normal urine, bring it from home, early morning sample, simple test, 30 bucks. if it confirms you have urine, your next step is, depending on your age and other symptoms that you may have, whether you have a family history of cancer, we either do a simple ultrasound, non-invasive, no radiation, simple to do, or we do a plain CT scan. Again, minimal radiation. It costs you $400, I think, about that. And you have a very detailed image of the body. So once you have those two pieces of information combined with my examination and history, I usually can at least tell you whether it's the kidney, the bladder, the prostate, the vaginal infection causing blood in the urine. So I'll be able to tell you at least where it's coming from, and I can roughly tell you what it is. So depending on where it's from and what the diagnosis, whether it's a stone or cancer, we treat it.
Yeah.
Right. So pretty simple.
Okay, yeah, and I think right now in Thomson Hospital as well, just to make it easier for our followers and our patients as well, we have this service called Blood Draw and Go, so that you can literally come in here and drive through and get your test. So
all right,
yeah, you can actually get the what do you call this? the thing.
You know,
Sorry.
by the way, sorry, can I interrupt you?
Yeah, sure.
You know something? I'm really happy you said that, because I just realized I forgot something.
Yeah.
So in addition to doing the urine test, we need to do a blood test, right?
Right. Okay.
So and I'm really happy you mentioned it, because we do a blood test, look at kidney function, and we do a blood test to measure your blood levels to make sure you haven't lost too much of your blood. And as Meena said, look, it's really easy. Get your token, drive through, we grab your blood, and we'll call you with the results. So we'll send you the results on a messaging service if we need to. Right?
Yeah.
So dead easy. And that's a good service, by the way.
Yeah.
And actually, I didn't know we had it.
Yeah. We have it. We actually have it. And in terms of this pandemic, and we're trying to minimize contact in our hospital area. And I think this is a great service.
Yeah, it is. I mean, it's a fantastic idea, because it saves time. You don't have to queue up. You don't have to find parking. Yeah, I wish I knew about it. Okay, I'm going to go. Right. Hold on. I'm going to scold Hilmi next to me for not telling me about it, because he's the guy in charge of this. Let me scold him after this. All right.
All right.
Okay.
But what's a dipstick test?
All right. So a dipstick test is what a lot of smaller clinics and the pharmacies do. They basically take your urine, they put this strip inside, and it shows different color codes, right? So depending on the color code, it'll tell you whether you're blood or ketone or whatever. I don't really like it, because it's overly sensitive, right? So if you ate a kilo of mutton, which being Malaysian, we are highly capable of doing.
Yep.
Okay, and Hilmi is nodding his head, so I'm pretty sure he's done it. Okay. So you eat 1 kilo of protein and you do the dipstick, it might come back positive. Right. So it's a lot of false positive readings, because all it's doing is checking chemicals in the urine. And so what it does is, for example, if you have blood in the urine, the blood will release a chemical and the test will check for that chemical. That's all it does. But it doesn't show you whether you actually have blood cells, white cells, cancer cells.
All right.
And a dipstick will cost you $15, $20 to do in a GP clinic. Pay extra $10 and you got a much more detailed, because if your dipstick is positive, I will order a urine test for you. So save money, just do the urine test. Easier, cheaper, faster. And if you bring your sample, we'll try passing it through the drive-through as well. I'm sure the lab techs will be impressed that they have to collect urine sample through a car window, but anyway.
No, actually, you go back home and then
so that's cool.
Yeah.
So they don't have to pee in the car.
No,
I'm kidding, right? I'm kidding on that one, right?
We spoke about diagnosis, right?
Right.
Process of it. So what about treatment? And I understand that blood in urine actually indicates many things like UTI.
Right. So
most common treatment.
All right. So right. So the world has moved on quite a bit, by the way. So most of what urologists do nowadays is endoscopic. That means we don't actually cut we use cameras and either through your penis or through your urethra or laparoscopic instruments. So let's start with stones, right? So stones, we have non-invasive and invasive treatments. Non-invasive is what everybody in the world calls laser. It's not a laser, by the way, but everyone calls it laser. Even I call it laser. It's actually sound waves. You pass sound through the body, hits the stone, breaks the stone, and you pee it out. Simple, easy to do. Second one, if the stone is in a very weird spot or it's very large, you just pass a camera in, go to the stone and laser it. And actually, that's our commonest procedure. Like I did I did 3 yesterday, and we do 2 or 3 every day. Very common. If you have a cancer, and if it's a cancer in the bladder, you put in a camera and you just laser or burn it off. That's it. If it's in the kidney, a bit more complicated. We sort of have to remove part of the kidney or the whole of the kidney.
Okay, so if you find a stone in your bladder, am I correct? That's the one that you were saying that we are using the laser for, right?
Yeah, you can. So what you do is also in the kidney and the ureter.
Okay. So the procedure will take about an hour. How long will it take?
Okay, the shock wave, the sound wave, 20 minutes. It's a daycare. You come, you do, and you go home.
Okay.
By the way, the unit here, we pride ourselves on pain management. We're really good at it. So it's painless. I know you don't believe me, but it's actually painless. You basically chill out for 20 minutes, gossip with the nurses, and go home.
Okay.
Okay.
All right.
Yeah, that's the shockwave.
Okay.
And that's a rough idea of what we do.
All right. Okay. We actually have 2 questions here in our DM, so I'm just going to read it out.
All right. Let's go for it.
The first one is, I actually noticed there's blood in my urine and I'm pregnant. Should I be worried?
Yes, right. So when you are pregnant, you undergo certain changes. Okay, so your body is designed to carry a baby, right? And part of it is the whole urinary system dilates, it becomes bigger. Your immune system sort of goes downhill a little bit during pregnancy. I'm making pregnancy sound scary. Okay. But basically, it means you're a bit more prone for urine infections. Okay. Check it, because urine infection in the first 3 months can cause you to abort the baby. Urine infection in the last 3 months can cause you to deliver early, right? Do not use any feminine hygiene products when you're pregnant. If you're going to wash down there, wash with water. It will reduce your risk of infection. Number 2, and this is really important, when you see blood in the urine, when you strain to pass urine, it could be from a vagina. That means it could be a vaginal bleed. If you're pregnant and it's a vaginal bleed, you need to see a gynae, right? There could be a problem with your pregnancy. In fact, there is a problem with the pregnancy if you're bleeding. There's no may, it is, right? So if you have discomfort, if you have blood in the urine and you are pregnant, you really need to see your gynae. All right. And it's really simple, right? He's just going to an ultrasound, make sure the baby is okay. He's going to check the kenching okay, check the vagina, make sure there's no bleeding, go home. And you're pregnant, we're not going to do any surgeries for you. We're just going to give you medication. Easy. Okay. Simple. It'll take you about 30 minutes to get checked out by your gynae, right? That's it. Very worth it.
Okay. All right. Yeah, I hope that answers the question. Okay, the second one is, I have blood in my urine. This is quite interesting. I have blood in my urine every time after having sex with my husband. That right.
Okay. So the question I asked this, and this is very common. And I blame it on internet marketing. Okay, strangely, ever since feminine hygiene products became a big thing, and there are many on the market, a lot of women use it to so that they're a bit more dry, a bit more clean, or whatever reason. Understand that your grandmothers never use any of this stuff. Your vagina becomes a bit more dry, right? And if you have sex and bleeding afterwards, you either have injury to the urethra, the part you pass urine, so it's blood in the urine, or you have vaginal bleed. Either way, not a good thing, means your vagina is dry. Second thing is, blood in the urine or blood in the vagina after sex is a sign of cervical cancer. Sorry, was that a vaginal bleed or urethral bleed? Because with women, it's hard to tell.
I don't know. It just said that blood in urine every time after sex.
Right. So the thing is, if you pee after sex and you got blood in the urine, it might not be from blood. The blood might not be from the urine. It can be a vaginal bleed. That's why I said that. Because it is very, very difficult to confirm that the blood you're seeing is actually from the urine. Right? Because you pee, you can't look down and see when you're peeing, not very easy. But you pee and you get a few drops of blood or your urine looks red, there's a good chance it's coming from the vagina. If it's coming from, it's very rare to always have blood in the urine after sex. Very rare, right? But it's very, very common to have blood in the, as mixed with urine, but the blood's from the vagina. That is common and that's not a good thing. So first thing, very simple. When you're not having sex, I'm sure there must be some point of time when you're not having sex. You have to rest somewhere. Check your urine, right? Just check your urine normally. Check if there's blood. If there's blood, come and see me. If there's no blood, go see your gynae, ask him take a look at your vagina, do a pap smear, make sure there's nothing in the vagina. Right? Easy. Right. But it's not a good thing. It's not a good thing either way.
So it's definitely better to come and have a check.
Yeah, it's just a question of who. Okay. If your normal urine got blood, it's me. If urine doesn't have blood, see the gynae. And we have 13 of them sitting around the hospital having coffee. I'm kidding, by the way. Continue.
All right, anyways. Yeah, I think that's all we have. Yeah, that's all of the questions that's coming in.
Right. Do you have any questions?
Well, I think I'm out of questions.
All right.
Do you have anything you would like to add or any other information that you would like to share to our followers?
Look, urology is, if you have a urology problem, it's really easy, right? See any doctor you want, do a urine check first. Okay, whether it's blood in the urine, abdominal pain, discomfort while peeing, whichever it is, do a $30 urine check. Get your doctor to check your tummy, go through your symptoms, and you know it's easy. Do it early. Delaying and coming and seeing me is a bit of a problem because by the time you come, it may be too late for me to help you. Come early and we can basically fix almost everything.
All right. So it's like a yearly checkup.
Yeah, it's just, you know, it's a urine test. You just have to pee. Yeah. It's not difficult. Mina, by the way, you haven't come for your yearly test. So shall we see you tomorrow?
I don't know.
Come on, don't be chicken. Your pap smear and your urine test tomorrow.
Okay. I'll be there.
Kill me, you heard her agree, right? Okay, she can follow you in your 10-kilometer run and you can bring her for a test. All right. Hey, it was a pleasure talking to you. This was really nice.
Oh, wait, Dr. Muhilan, one last question.
Right. Yeah, sure.
This just came in our comment section.
Right.
Alright, Doc, nak tanya, mak saya ada masalah susah kontrol kencing, kerap kencing, terutamanya di malam. Dia pakai pampers dan juga kerap masalah kencing kotor. I believe this is what
I mentioned.
Yeah.
So the treatment is actually very simple, right? You treat the infection, rawat jangkitan dulu. Lepas rawat jangkitan, biasanya kena ambil ubat hormon sikit supaya tempat kencing itu akan buka, senang kencing. So bila senang kencing, kekerapan kencing akan turun, tak boleh kontrol kencing akan turun. Itu je. Very easy to treat. Okay? Hanya perlu makan ubat. Tapi ubat dia jangka masa panjang. And tak perlu pakai pampers, which is horrible. Tak ada orang nak pakai pampers.
Okay. Do you think it's overactive bladder?
No, this one is not overactive bladder. This one is called a urethral stricture, where bila kencing tak lawas, tak habis. So kencing tertinggal. So you akan kerap kencing sebab pundi kencing akan isi dengan cepat. Okay. So because you baru habis separuh je, tinggal separuh lagi, dia akan pundi kencing akan cepat kembang. So kerap rasa nak kencing. And bila tak sempat nak pergi tandas, dia akan keluar sendiri. Number one. And kencing yang takung dalam pundi kencing akan dapat jangkitan. And you akan dapat kencing kotor kerap. So it's actually very easy to treat. You perlu rawat, makan ubat, biasanya dalam 2-3 minggu dah okay. Tapi ubat akan untuk jangka masa panjang. Okay.
And then they're asking harus jumpa siapa doc? Doc ONG atau yourself?
Myself. Urology. Always me. Okay.
All right.
Okay.
Yeah, let me see. No more questions. No more questions. Yeah.
All right. So I'll wish you a good day. Really fun talking to you. And by the way, I've got your urine container here. Please come and collect it. And bring your morning sample. I look forward to seeing you tomorrow for your checkup.
All right. It's a free test, right? You're giving it for free, right? For me.
You do know I got car installments to pay, right?
All right. Thank you so much, Dr. Muhilan.
All right. I'll see you tomorrow.
To all our followers who have joined us today. This
right.
will be we will save this video on our Facebook, so like it, share it. Maybe it could help someone or one of your family members or even yourself. All right. Anyway, stay safe and take care, everyone.
All right. Have a nice day. Bye.